One of the impacts COVID-19 has had on people is weight gain. Snacking and limited activity has finally caught up with you, right? Well, some can easily shed it, while others really have struggled with it for quite some time. Perhaps bariatric surgery is something to consider. Join us is Dr. Eric Crable, bariatric and general surgeon, medical director of bariatrics for Mercy Health St. Mary's. Good morning. Thanks so much for joining us.
Thanks for having me.
Absolutely. So let's talk a little bit more about this. How has the COVID-19 pandemic affected patients suffering with obesity?
Really, the first thing to do is to define obesity. What are we talking about? It really is a chronic, progressive medical disease with a very strong genetic component. Many people, consider it due to a lack of willpower, which is just not the case. Michigan has suffered from obesity just like the rest of the country. It's one of 12 states actually with an adult obesity prevalence of 35% or higher. Many of these patients, due to obesity, also struggle with other health conditions such as high blood pressure, high cholesterol, type 2 diabetes, and even sleep apnea. These risks increase their overall severity of illness and even death from the novel coronavirus. It can triple your risk of hospitalization, and this obesity itself is oftentimes linked to impaired immune function, decreased lung capacity, and even a potential decrease in your response to vaccination.
And how is it that Mercy Health Bariatrics program can help?
We offer a multidisciplinary team approach, offering bariatric medical doctors and specialists, dietitians, exercise physiologists, counselors, psychologists, and even surgeons, such as myself, to offer help. Much of the focus early on is on education, offering deliberate lifestyle changes that encourage overall healthy eating, increasing your activity, adequate sleep, and even stress management. We provide a number of treatment options, which include both medical and surgical approaches.
Let's talk about those non-surgical approaches first.
Yeah, certainly. The medical weight loss plans that we offer provide a kind of structured framework around healthy eating, again, increasing your activity, and then having that behavioral health support, which we offer through multiple visits. We've had to adapt here just like everyone else, and do proudly offer telemedicine appointments for patients that may have trouble traveling during this time frame, and in adhering to the stay-at-home orders that we currently have. A number of anti-obesity medications can also be prescribed to help with appetite suppression, along with those other options mentioned.
And then if it comes down to it, you guys have various surgeries that you can perform as well, if you want to touch on a couple of those.
Sure. We offer a number of minimally invasive bariatric surgeries. We oftentimes utilize the latest laparoscopic and even robotically assisted technology. This allows patients to recover very quickly, typically with very little pain and discomfort. These surgeries, we always mention, they're not necessarily a cure. They certainly are a tool, and that's how we describe them, to help restrict caloric intake, potentially your absorption of certain foods, and altering your metabolism. Some of the most common surgeries we perform are called the laparoscopic sleeve gastrectomy and the laparoscopic Roux-en-Y gastric bypass. And similar to the approach with medical weight loss, we continue to support patients during this time frame, both before and after surgery, for as long as we can, to help maintain that weight loss.
All right, for someone who's ready to take that next step, what should they do?
Certainly, the best place to go really is to our website, morebariatricsuccess.com. There's much more information available there. You can even sign up for a free online seminar, which you can watch and enjoy from the comfort of your own home.
Fantastic. Thank you so much for your time this morning.
Thank you very much.
Absolutely. And the details are right there on your screen. Go to morebariatricsuccess.com.